amphetamine, not methamphetamine. Okay. To begin, look at that picture of the person, and it goes from 10 years of meth use. Methamphetamines are cocaine, stuff like that. And crack. Methamphetamines are illegal drugs that are powerful stimulants. It can ruin your health entirely, deplete your teeth. It actually not only eats away at your teeth, but it dries your mouth out, so it makes it more vulnerable. But as you can see, this woman went from looking decent to looking like she belongs in a cornfield as a scarecrow. It's awful, but true. Okay, amphetamines, and they were first discovered in the World War One or Two. I believe World War One. They were used by airplanes, pilots that had to fly for long hours. They were given to on army bases and naval bases and air bases. They were given to pilots to keep them awake for long periods of time. That's how they first got introduced. And then in 1955, Adderall got approved. Not Adderall, Ritalin. Ritalin got approved, and it began the ADHD phase. Now, attention deficit hyperactivity disorder has replaced ADD, attention deficit disorder. What happened was they were trying to, limit the amount of, they were trying to categorize it and be more specific. So they went with attention deficit, they took out attention deficit disorder and went with attention deficit hyperactivity disorder to be more specific. Did it really make a difference? I think not. Although medications have proven effective in treating some substance use disorders, there are currently no medications that counteract the specific effects of methamphetamine or that prolong abstinence from and reduce the abuse of methamphetamines by an individual addicted to the drug. NIDA has researched in the development of the medications to treat addiction to stimulants and other drugs a priority. However, wait, let's read that again. NIDA has made a research in the development of the medications to treat addiction to stimulants and other drugs a priority, however. One approach being tried is target the activity of glial cells. Okay, so right now we have no cure for, we have no way to fight the abuse of methamphetamines. I mean, the addiction phase of it. Opiates, we have pioneered in that field with Suboxone and stuff like that. Methadone, I don't agree with it, but what works. Anyway, methamphetamines, there really isn't a way to get around that. Okay, amphetamine, Adderall, short acting, 4 to 6 hours. Adderall is the primary method to treat ADHD. However, it only lasts for 4 to 6 hours, so they introduced Adderall XR, which still doesn't last the entire day, but it is longer, and some people take it 3 times a day, some people take it twice. It just depends on who's treating you and what they think is best for you. Ritalin is a type of stimulant. It lasts 3 to 4 hours. This is a bad thing because 3 to 4 hours. That's just not long enough. It's short acting. All these are short acting. This is Ritalin is in a different class of drugs. It's not an methamphetamine, but it is a type of stimulant. Strattera, long acting, extended release. Strattera is not a stimulant at all, but it acts like one. Strattera looks like it's relatively effective in the treatment of ADHD when stimulants have not been used prior to Strattera. It seems like the studies show that Strattera is more potent if the person's never been on like Ritalin or Adderall, but the brain recognizes the Strattera, the drug, in a much more effective manner if it's never been introduced to strong stimulants. Strattera is not a stimulant, and it's very popular to treat these type of things. It also seems to be helpful in depression. So, I mean, it has a lot of benefits. Okay, Wellbutrin, short-acting, 4 to 5 hours. Now, Wellbutrin is a antidepressant, but it has some stimulant effects to it, and those last 4 to 5 hours. So, I mean, it can be effective. I know a lot of doctors use Wellbutrin to treat problems, dual diagnosis problems, but it only lasts 4 to 5 hours. I find that troubling, but the FDA has issued a warning about the risk of drug abuse with amphetamine stimulants. FDA safety advisors are also concerned about the possibility that all amphetamine and methylphenidate stimulants are, for example, Ritalin. Ritalin is a methylphenidate stimulant used to ADHD may increase the risk of heart and psychiatric problems. So they're worried that amphetamine stimulants can, give you heart problems and psychiatric problems. But, the FDA has also issued a warning about a connection between antidepressants, including the non-stimulant Strattera, and an increased risk of suicide in adults aged 18 to 24, especially in the first 1 or 2 months of treatment. Well, if you look at the studies, all antidepressants have some suicide rate. Is stimulant antidepressants any higher in suicide rate? Not really. Now, don't get me wrong. Stimulants can cause problems if you with certain diagnoses like bipolar. They do not like to put people on stimulants who are bipolar. In fact, that's considered heinously. Maybe heinous is the wrong word, but it's considered it's ineffective and adds to problems. Stimulants should not be used with people who have these type of problems. While these risks may seem alarming, keep in mind that experts generally consider these medicines safe when they are monitored properly by a professional. Serious problems are rare, so you should discuss. Okay, so discuss the risks with your doctor and know that it's really not a big risk. But if you certain diagnoses should abide by certain things. Okay, so now you know what the difference between methamphetamines and methamphetamines are. There are many ways to go about treating ADHD, and there are some effective ways. Adderall XR, extended release, seems to be very effective. But these drugs are also very addictive and abused heavily. So be careful out there. Good day, good night, good mental health.